Vivint Health is proud to be a partner of this year's World AIDS Day observance hosted by the National AIDS Memorial. As we mark 40 years of the AIDS pandemic in our country, we are turning the corner. There is such great hope that lies ahead. So many leaders have helped create the path of progress that we've achieved over the last 4 decades. Chief among them, Dr. Anthony Fauci, who first guided our nation through the AIDS crisis and now another pandemic, COVID-19. However, it will be the next generation, today's young people, like those in conversation with Dr. Fauci now, who will help us cross that bridge to a day when AIDS is defeated. They will spark the movement that eliminates the fear, stigma, and injustices people living with HIV and AIDS have faced over the last 40 years. At Vivint Health, we are proud to be a partner in this mission as we provide HIV prevention, care, and treatment to people all across the country, helping them live a long and healthy life. For us to get to a future free of HIV and AIDS, we must remember the stories of all those we've lost, those many who live on, and all of their resilience. And we must continue the fight for health and social justice. This conversation with Dr. Fauci and these wonderful young leaders gives me hope that on this World AIDS Day, we're within reach of that dream of a world without AIDS. Thank you.
Welcome to this World AIDS Day conversation hosted by the National AIDS Memorial as part of its virtual national observance. I'm Michelle Meow, host of the Michelle Meow Show and also a member of the Board of Governors for the Commonwealth Club of California. This year, as we mark 40 years into the AIDS pandemic, more than 700,000 people in the United States have died from the disease in the 4 decades that has spanned. Today, as we continue to face the impact of COVID-19 and the loss of life that has exceeded that of the AIDS pandemic, we bring together young thought leaders to look to the future and get their insights into issues that we face today. Since most of the young leaders who are joining our conversation today did not live through the early years of the AIDS pandemic, we've asked one of our nation's most renowned health and scientific leaders, Dr. Anthony Fauci, to provide some opening remarks and engage our young leaders with a series of questions to connect the dots from one generation to another. But first, I'd like to introduce our young leaders today, all recipients of the National AIDS Memorial Pedro Zamora Young Leaders Scholarship Program. This scholarship program has awarded more than $400,000 in financial assistance to over 100 students since its inception. It's truly a wonderful program and is supported through partners such as Gilead Sciences, which is the presenting partner of today's World AIDS Day observance. Today, joining us are Gray Gattero, who has a BA in politics from Willamette University and also is a fellow at AmeriCorps, Bo James Huang, who is a post-baccalaureate pre-medical student at UCLA, Abdon Oristida, who's got a BS in health services, a Master of Health Administration from the University of Central Florida, Craig McFarland, who's pre-med at Harvard University, and Laura Potter, who has a BA in human biology from Stanford and also is a medical student at UC Davis School of Medicine. Thank you all so much for your hard work. You are all so inspiring, and we have a whole lot to talk about today. Without further ado, I'd like to introduce Dr. Anthony Fauci to start off our conversation with his perspective on the AIDS pandemic and also hope for the future. He'll also help kick us off our very first question in our conversation. Here's Dr. Anthony Fauci.
Warm greetings, everyone. I am very pleased to join you virtually as you gather on this World AIDS Day, 40 years and a few months after the first reports of the devastating illness that came to be known as AIDS. Let me take you back 4 decades to the very beginning to give you a sense of how far we have come. I remember quite clearly sitting in my NIH office in June of 1981, reading in the Morbidity and Mortality Weekly Report about 5 cases of an unusual pneumonia among gay men living in Los Angeles. I blew it off as a curiosity and likely a fluke. That was a one-off. A month later, when a second MMWR report described an additional 26 cases of gay men from Los Angeles, San Francisco, and New York City with not only this unusual pneumonia, but also other rare infections and Kaposi sarcoma, I felt chills up and down my spine, literally. I knew that we were dealing with a new infectious disease and we had no idea what the etiologic agent was. Against the advice of many, I decided right then to turn around my career and conduct research on this devastating illness that was stealing young lives prematurely. The emergence of the AIDS pandemic transformed my professional career, if not my entire life. Our 40-year AIDS journey since then has been punctuated by periods of darkness as well as hope. In the early frustrating days of the pandemic, we had little to offer our patients. Gradually, we saw the first glimmers of hope with useful treatments for opportunistic infections and the first partially effective antiretroviral drugs. Then, in the mid-1990s, multi-drug antiretroviral regimens transformed the prognosis of HIV infection from dire to excellent. As years went by, newer drug combinations were introduced that are more potent and better tolerated, and frequently given as just one pill once a day. Thankfully, our collective efforts have successfully turned HIV/AIDS from an almost certain death sentence to a manageable chronic disease for those who have access to antiretroviral therapy and the support to stay in care. Today, World AIDS Day, we can reflect on 40 years of remarkable progress in understanding, treating, and preventing HIV disease. Ending the HIV pandemic is an ambitious but feasible goal, and I hope some of you will be part of achieving that goal. The global AIDS community is working very hard to better implement our many evidence-based tools to prevent and treat HIV and to develop new tools. New approaches to HIV treatment and prevention, including vaccines, informed by our experience with COVID-19 vaccines, are being developed and optimized. Efforts to find a cure remain at the top of our research agenda. I am especially pleased to be speaking to this audience of young people, as I suspect some of you will be part of the next generation HIV investigators and community partners. I am confident that someday, in the not-too-distant future, we will together close the book on the HIV pandemic. And so please stay well and enjoy the rest of the event. Now, it is my turn to ask you a few questions. And so here we go. First question. When I started in my career, I expected it would go in a very traditional direction. But I've been challenged with unexpected circumstances, notably the emergence of diseases such as HIV/AIDS, COVID-19, and many others. Each of these affected me personally and influenced my decisions to want to do more to help. And so I'd like to ask you, how are you preparing for the unexpected that may happen in your lifetime? How do you think you and your generation will lean in to be part of the solutions when the unexpected inevitably happens?
What a great question by Dr. Fauci. I will tell you that I felt completely unprepared for this pandemic. And let's include in your answer to the question, even, what we were unprepared for. I feel like even the systems of our society, education, health, all of it, the societal impacts of COVID-19 kind of caught us off guard. Let's start with Abdin.
Throughout the past few years, it has seen many unexpected changes occur in our nation. We saw a pandemic change our social structure and the ways that we behave, care for one another, and how we take care of ourselves. Additionally, there have been civil tension with changes in the political air. We have seen our brothers and sisters suffer at the hands of oppression via social media and a virus that we are learning more and more about each day. Currently, I am prepared for the unexpected by continuing my education. We have moved to online instruction in many cases, or some people are doing mixed mode. So what my plan is to continue my education and obtain a PhD in health administration so that one day I could have the platform to educate others in the university setting. I aim to open the minds of future generations and offer a unique perspective through my own experiences. We are preparing by the unexpected with education, compassion, and being aware of those around us. We are united and are crossing barriers together. I am very proud to say that our generation is one of resilience. We have compassion and care for one another and take into consideration mental health while trying to understand the root cause of what causes our problems and what causes certain behaviors. I believe that our generation will push towards understanding what the root cause of the unexpected and try to be there on a social perspective, offering assistance to one another like we did during the beginning of the COVID-19 pandemic.
Gray.
There is definitely a lot of unexpected and really unfortunate kind of outcomes related to the pandemic and how it affected all of our lives. But when I think about, preparing for the future and learning from what we've all experienced, I think about when it comes to unexpected situations and crisis, there's really two ways that you can go about responding. And so that is prevention and that is resilience. Prevention being doing what you need to do to make sure that you are ready for the damages that you can foresee, and resilience is having a solid infrastructure in place so that you can minimize the consequences in the long term. And what I've kind of learned from how unexpected this pandemic is that we were lacking in kind of information and a sense of where the root of these consequences would come from. And what's really exciting, I think, about my generation of leadership is that we are very diverse and we are able to incorporate so many different perspectives and bring different voices to the table that can give us a better picture of how to be resilient and how to have effective preventative action in the future in just a more long-term, well-rounded way.
Laura.
I completely agree with what both of you have said so far. I love, Gray, the way that you framed it in terms of the prevention and the infrastructure. And I think what I'll add to the way that I think about it is that what you were saying about the diversity of our generation's leadership is so key to merely making sure that the rollout of that prevention and of that infrastructure is equitable. Because one of the things that struck me so much about the unexpected parts of this COVID-19 pandemic, which definitely harkens back to the HIV/AIDS pandemic that we still find ourselves in, even though in a better place, is how it does not affect everybody the same way. Both in terms of the infection and the disease itself, but also the other consequences that come along with missing work, or even with trusting whether the vaccines that are developed are safe for my body. Have the people in those clinical trials really represented me? So I think there's a lot that we can learn from both the HIV and COVID-19 pandemics when it comes to preparing ourselves for the future, taking care of everybody and making sure that we are on equal footing going into these things, and everybody can come out also on that same equal footing.
Craig.
Thank you, Laura. I agree with everyone, and everyone is so well spoken and added such great points. Just to add, I believe that advocacy for basic human rights is truly how we should prepare for the unexpected. I believe that the core and the root causes for a lot of a lack of preparedness for the future comes from a lack of care or concern for basic human rights. We saw this in the 80s with the dehumanization of homosexuals and queer folk. We see this now with the dehumanization of immigrants, the homeless, and other marginalized groups. And in all honesty, I believe that we prepare for the future by forcing the government and society at large to treat all human beings as human beings. And fortunately, I feel that my generation has been bringing light to a lot of the societal issues that have been pretty quiet in the past and that many former generations have remained complacent towards. So with that, I believe that just by pressuring the government and society to see queer folk, Black people, Latinx people as humans and treat them as such is how we prepare for the future.
And Bo, I kind of saved you for last because I know that, so much of your work focuses on an intersectional approach. And so we'd love to hear your thoughts on how we prepare for the unexpected in the future.
Thank you for that question, Michelle. Each of y'all brought up super important points that I wanted to raise. So very grateful for all of y'all like introducing those points. I just want to say real quick, like even when we were like in the start of the pandemic, we're talking about working from home, but like my family, we didn't even have Wi-Fi. So just thinking about like that, a lot of those, I think Gray brought it up about kind of like sustainability and kind of like Laura brought up about like being equitable as well. A lot of these methodologies that may work for some communities may not work for all communities. I think one thing to prepare is like learning from the past. And Abdon brought up about like higher education, and I'm all for that too as well. And at the same time, I feel like there are a lot of things in the education system that is not brought up. So I like to like kind of learn. So I've been like reading books like Medical Apartheid or just like other books. I'm like a super nerd. I think just preparing for the future, learning from the past and recognizing the intersectionality of all of this. So, and I think one last thing I want to bring up is that our generation, the amazing thing is that we have so much information with social media, but how can we do good with all this information?
Thank you so much for all of your answers. And, I love that it centers humans, it focuses on humans. And you're right. We should be prioritizing all human life. Why don't we go back to Dr. Fauci and have him ask his next question?
During the darkest days of the AIDS pandemic, activism by mostly young people helped raise greater awareness, forced leaders to listen, and helped change hearts and minds about the disease. Over the course of the past few years, I have seen that same engagement and passion on a host of important issues our country has faced. What role do you see activism and advocacy playing today and in the future? And what issues do you feel are most important to lend your voice to that can help direct change and shape positive outcomes?
Another great question by Dr. Fauci. And, we've seen the passion from our younger generation, whether it's been racial inequality or addressing the inequity to vaccine access. So yeah, let's talk about this very important topic. But why don't we start with you this time around?
I think it's the similar story, different situation. Like the AIDS pandemic and now with the novel coronavirus pandemic, I don't want to say it's the same story because right now we have access to a lot of resources we might not have in the early days of the AIDS pandemic due to scientific advancement and so forth. I believe that activism really plays a role in terms of advocating for other communities as well. As a queer trans person, although like that's my community and that's what I like want to advocate for, even in this work right now with the novel coronavirus, I'm doing a lot of work specifically in the Black community. And how does that come into play in terms of being an ally for other communities, kind of like making space and creating space? Because I feel that as our communities come together, Gray mentioned about like all our communities coming together, working toward like being more equitable and being more inclusive. I believe that it's super important for us to make space and create space in our activism so that we don't do harm when we're working together. I think we have a lot of things weren't mentioned before, like other isms in our community, whether it be classism, racism, sexism, and so many other isms. And our generation have so many things to tackle. However, I believe that if we work together and at the same time holding space for our stories and holding space for our fellow other communities is super important in terms of activism to be more equitable going forward and including communities that have been marginalized.
Great.
Thank you for that, Bo. Yeah, just to kind of continue speaking to the diversity of the communities in our generation that are coming together to take lead. A really important aspect of that is that because we have different representatives of different communities and we have the understanding of the nuance of all these different isms, we've come to realize that different communities require different care, different tools, different response. So when I started, my advocacy, my activism, and educating myself, I started in advocating for sexual and reproductive wellness, advocating for the humane treatment of LGBT people, advocating for affordable education while I was in college. And now what I'm doing is I'm working on sustainability and environmental issues more broadly, because I think it's very important for when you're building a lasting infrastructure for change, you take it to the community level and you're allowing communities to educate themselves and be informed and make decisions on how they're going to build out their future to be sustainable and meet their specific needs. So I think a big part of my advocacy as I've grown as an activist and an educator is empowering people at a community level to take charge of their own agency, their own future, and their own kind of health and sustainability going forward.
Amazing. Laura.
I think when it comes to activism and advocacy in this current age where we do have, like Bo was mentioning, like powerful social media that can give a lot of people who may not have had access or voice before a platform to speak. One of the things that I, especially during like the early moments of the Black Lives Matter movement and things like that, started to think about more personally was, well, what is the space that I'm taking up on those platforms? Maybe there's room for me and other people to step back, because even though there's room on those platforms for everyone to have a voice, they can still be dominated by certain voices. And so that's one of the things that I have been thinking about a lot, especially in my current development and educationally as a medical student, because we're often encouraged to speak and to use our voice, maybe at like the local or even higher political levels when it comes to policies, health policies that can help folks. So I'm thinking about that a lot and trying to be very critical about when I use my voice, how I use my voice, and whether I can pull other people into those conversations using maybe the power and the position that I have to lend that voice where it's needed most.
Abden.
In my own views, what I did, what I used to serve for the Florida Department of Health in Orange County. I was a disease intervention specialist for the HIV and STI clinic. That gave me a very unique opportunity to be able to provide education, testing, and treatment for patients all around. We would have patients sometimes that would come all the way from Jacksonville because they would tell us that they weren't comfortable seeing their providers there. So it was very, very nice to be able to be like kind of like a safe haven for a lot of people who probably didn't speak the language. They had barriers. Maybe there was cultural barriers or religious barriers. So I really enjoyed that while I was there. But the truth is that I believe that activism, the changes begin at the local setting. Attitudes and beliefs, they have to change before they go to the state level. So activism is imperative to change, and we must begin by educating one another and coming together with an open mind and an open heart. As activists, we must use our voice to be able to stand up for those who don't have a voice and stand for those who are oppressed. One of the biggest things that we must do is look for something that you strongly believe in, a platform that that you are 100% for, but then look for other platforms for other people, or look for other activisms that are happening or social causes that are happening around you. Because we shouldn't really be looking at like what's different about me and the next person or what's alike about the next person. We should just totally just stand with each other. Whether it's like, supporting for Free Palestine, Black Lives Matter, migrants and social causes, Stop Asian Hate, supporting our trans brothers and sisters, or even be there for the Me Too movement. Just because it's not happening to you doesn't mean that it doesn't affect you. So we should always be there for our brothers and sisters, because we never know. It could be the next person next to us, but that doesn't matter. We're all humans, and we're all standing up to be humans with each other.
And Craig.
Thank you. For me personally, I argue that there are two central dilemmas that are involved with getting started with advocacy and activism. The first being the bystander effect. We are psychologically predisposed to believe that there are already other people who are finding the cure to some novel disease or solving injustices. And the second dilemma is that we're just unsure what issues to help with. The world is so incredibly flawed, and there exists virtually an infinity of problems within our society. So my piece of advice to help that helped younger me start my own activism comes from my favorite quote. It is, "Whoever saves a life saves the world." This comes from how my high school guidance counselor, Stephanie Simchick, shout out to the best person ever, brought me to my first Pride Parade when I was still in the closet. And just that act of kindness for this one person helped jumpstart me into a world of advocacy and social justice. And now I'm involved with AIDS, HIV research, policy advocacy for racism in the medical field, and other issues like domestic violence. And although there are a multitude of issues that I'm not involved in, I feel as though saving the lives in these three core societal issues that I'm involved in, saving those lives, is enough for me to keep going. And I know that that's enough contribution for one person individually. So just find some issue or a multitude of issues and just get really involved in those. And that should be enough.
All incredible responses. And this is a bit of a bonus, but I personally feel like there's a sense of urgency and impatience that we once felt during the HIV/AIDS epidemic, in which when our world leaders are failing us or not listening to us. I feel like with the younger generation, I mean, there is no waiting. There's not next year. There's not even tomorrow, because of what, Laura had said as well. We're so well connected in our communities and organizations. We're mobilizing a whole lot faster. And so this is an open question to any of you who'd like to answer, but do you feel the same way? Do you feel that, in some ways, a revolution is coming, or that if there were to be another crisis, there is no more waiting. There is no more, let's see what happens. We are asking our world leaders to change. What do you think? Gray, would you like to add some thoughts?
I do feel like our generation of leaders does not feel compelled to wait for anyone, because there's a sense of urgency. There's a sense of, if we don't act now, there's no tomorrow to act for. And empowered by local and community decision-making and choice and activism, we don't have to wait anymore. We have resources at our disposal to roll out community and local responses that collectively will make the change on the large scale.
Anyone else want to add?
Additional to that, like you see that a lot, especially within our community. And by our community, I mean like LGBTQ, trans, and everyone else that falls into our beautiful spectrum. Something that is very beautiful within our community is that we're very collective. We're not individualistic at all. We all take care of each other. You can see it on the holidays like Thanksgiving, Christmas, I don't know, Eid, if you celebrate, and Kwanzaa, and everybody's always saying like, hey, if you don't have a place to go, come over, plenty of food over here. And we have our Friendsgiving. We create our own like networks of family who our friends become our family. And that's something that's extremely beautiful. And I love to see every single time that I'm out with my community. I see it on social media. None of us wait for it. None of us are here to say, oh, the next person's going to do it. No. We take charge. That's something that's absolutely beautiful in our communities, that we take charge to help one another. We see someone that needs help or that's down. We're so ready with the mental health, to offer all these assistantships, or have a friend who will hit me up that probably lives 30 miles away, and they say, hey, I'm having a crisis right now. I need to get tested and this happened. And I'm like, great, here are the resources that I have for you. Here's what I can offer for your local area. Here's what I can offer you in my area. Please come through. Let me know what I can do for you. And that's something that's absolutely beautiful in every single one of our communities. We all take care of each other.
I love it. I feel so protected with you all as leaders, our future leaders. Well, let's get back to Dr. Fauci. He has your final question.
Over the course of the AIDS pandemic, we have seen stigma, discrimination, a disproportionate impact on marginalized communities, health and social injustice, political inaction, and unnecessary loss of life. The same holds true for the COVID-19 pandemic. As you look to the future, What lessons do you think can be learned from the responses to both pandemics that could help the nation avoid the painful lessons of past pandemics in the next pandemic?
Laura, would you like to help kick us off?
I would love to. Thank you. I am again struck by, I think, the importance of both activism and community from the community, but also from the government and these larger structures that we do have guiding our society. When I think about how can we be best prepared for similar crises in the future, or even still emerging from the current crisis we find ourselves in, we can't just rely on these beautiful communities that we were just talking about, because the work that we all do is incredible and so vital, but it does have its limits. And there is a lot of room for more diversity and representation in the power structures that do lead our country and our world. And I think that really developing community in those spaces is going to be really key to how we approach future crises.
Abden.
As a community, like, we do absolutely have our limits, and there are some portions where the government should step in. But I also believe that we don't have to wait for the government all the time to be able to step in. The government is doing their portion. Like, for example, all the wonderful research that they have done for HIV and AIDS and for COVID-19. I strongly believe that we need to believe in science. We need to believe in, the research, the millions of dollars that have been put into research. And, there's obviously a lot of questions. And how, for example, it was mentioned earlier, how does the vaccine affect me? Or how does it affect the person next to me? Because is there enough representation in the trials? And while that's very true and everything, I still believe that, as we continue our path towards, getting our community to recover and everything, I believe that we should have a little bit of give a little grace to our government because of all the work that they have done, we should believe in science, believe in each other, and believe in peer-reviewed article and research. That is so important because, what Uncle Sam on Facebook might post, he'll reshare it and reshare it and reshare it. And it's just mindless, research, but does it have any grounding? Is there any backing up of it? So I think that all of us have to be able to understand, what they are saying on the top level and be able to, bring it down and, provide it in an education in a language that people can understand, whether it's in English or German, English, Spanish, Arabic. Make sure that the people in the community are able to understand the message that you're trying to give out, and be there for them. It's so important to be there for them, and also break down those barriers of stigma. People didn't want to get tested before. People were afraid of HIV or even knowing, and they suffered tremendously because of it. Our healthcare workers who have been on the front lines, diligently, because I was there at the very beginning of the pandemic, working in the emergency department, not knowing, what was going to happen. There were days where we were either slam packed with patients, or there were days when we didn't have patients at all because people were afraid to come in to get tested or to get any treatment because they thought that if they would come to the hospital, they would die. And it was very, very unfortunate. And we shouldn't have to see that again in the future. What we should have is a platform or an area, a safe space where patients, people, anyone, whether you're a citizen or not a citizen, whether you're religious background or not, whatever it is, be able to seek help and don't be afraid. And we should be able to create a safe space for all of that.
Thank you so much, Abden. Craig.
For me personally, I believe the biggest issue I learned is that these issues of communities is at large an issue of humanity. So, for example, with the COVID epidemic, when someone would tell me that their grandma passed away as a result of COVID, I myself realized that could be my grandmother, that could be my own relative, that could be someone I love. And I believe that with the AIDS epidemic, unfortunately, this dehumanization that happened towards the queer society and homosexuals specifically resulted in people not having this mindset that, oh, these diseases do discriminate, this is an act of God, etc. But with COVID, we learned that diseases do not discriminate for the most part. And now in the future, learning all these lessons, I'm more optimistic that we see these issues of society to be something that is a group effort and that anyone can be affected, and everyone should have the mindset that anyone could be a victim. And for that reason, I think that we'll be more likely and more prone to mobilize efforts, no matter who in specific is targeted. So I'm very fortunate for that.
Bo.
That's such a great question, Dr. Fauci. Laura mentioned previously about how this pandemic impacted different communities differently. Dawn mentioned about language equitability, and I think it's extremely important to have community and at the same time holding our officials accountable as well in terms of allocating funding. Not everyone has access to Wi-Fi, have a smartphone, neither do they have a working computer or laptop. And thinking about those also, I think will be extremely important moving forward in the future if we were to ever live through different pandemics, recognizing the different needs that different communities have. Not everyone have a extra room in their house to quarantine in. Not everyone has access to insurance and so forth. So I think that's really extremely important, just allocating funding differently and recognizing that this pandemic hits our communities differently.
And Gray.
It's really great to hear everybody's perspective and reflections on this. I appreciated what Craig had to say about really what comes down to empathy. If your neighbor's house is on fire and you turn away because that's their problem, and then you're surprised when your house catches on fire, like that's willful ignorance that does yourself, your loved ones, your neighbors a disservice. And we saw that with the AIDS pandemic, that is a gay problem, or with COVID when it first started, that's an Asian problem. And that kind of ignorance and divisiveness really allowed these issues to just become so much worse than they needed to be if that wasn't done at first, or even if this is a gay problem, but we should help or be empathetic and start looking into how to uplift and elevate the issues in this community so that it doesn't extend to other communities. So I think that kind of empathy is really integral going forward. And then the other thing, again, I really think that developing equitable, sustainable infrastructure is the future, and being willing to learn from our mistakes and not cling to systems that have proven to be ineffective and inefficient in responding. Like, we could admit that we were wrong. We could admit that maybe the way that we provide community health isn't effective. And sure, it might be lucrative, but there are other ways that those costs can be offset to create a better quality of living and a stronger economy in the long run. So it's just thinking more in the long term and thinking more empathetically, I think will make the world a difference.
And those are all beautiful thoughts. And I feel incredibly lucky to have spent the day with you and to share space. And I feel we're all super lucky to have you as our future and our thought leaders today. Thank you to each of you. This concludes our program. Thank you for your work, your heartfelt stories, and your impact on history. This has truly been a powerful conversation. Also, thank you to Dr. Fauci, of course. To all our young leaders who are joining us today, thank you. And thank you to all of you who are watching and joining us today. The National AIDS Memorial Pedro Zamora Young Leaders Scholarship Program is having an impact. Clearly, by having these scholars here with us today, you can see that they're having a major impact in our society. There are just a few of the many young people across the country who are doing amazing work that's making a positive and important impact. To those watching, please join one of our other World AIDS Day conversations taking place today. If you miss one, they'll be available for viewing anytime at aidsmemorial.org. Also, stay tuned, the National AIDS Memorial, and I invite you to stay tuned as the National AIDS Memorial officially announces its next selection of scholars in early 2022. Again, thank you for joining us today, and thank you to the National AIDS Memorial for hosting this forum and the many partners who have joined together to support this World AIDS Day observance. These are all important discussions we are having today. These conversations help build bridges. They help create better understanding. They help us learn. And remember that they help us to look to the future. And of course, brighter days are ahead. I am certainly very optimistic. We can all do this together as a community on this World AIDS Day. Thank you.